think there's a feedback. All right, so the first question we're going to ask, what is hormone imbalance? Because this is the topic and that we are looking at. So the first question I would have asked, is there any feeling of bloatedness, irritability, or just not your best? This can be due shift in your hormones could be to blame. What are hormones? They're chemical messengers that impact the way your cells and your organs function. All right. So hormones, they're chemical messengers. What I mean by chemical, I mean that they're literally chemical inside of your bloodstream that is sending message to your cells and to your organs to tell them how they should function. All right. So these are hormones. It's normal for your levels of them, which we are talking about, of the hormones, to shift at different times of your life, such as before or during your periods, or at pregnancy, or during menopause. Now, these are the most dramatic time in a woman's life, and therefore we will feel the changes because different hormones are at play during that time. Okay, so the 4 main stages. All right, Sister Donna, we're going to have a nice gift for someone who can, we can ask 1 or 2 questions and they can have the answer, such as this. What if I ask, what are the 4 main stages that were mentioned when a woman's hormone tend to be most out of sync? All right, or when they shift. When are the 4 times mentioned? All right, okay. But some medications and health issues can cause your levels to go up or go down too, all right? So basically, there are 4 times naturally in our lives when this can happen, and there can also be affected by drug medications and also by health issues. So these can affect our hormones. No, there are 5 hormone imbalances to be aware of. We have the cortisol, we have estrogen, insulin, progesterone, and testosterone. All right, remember these. They are in our bodies, especially as females. They are working out themselves. Cortisol, estrogen, insulin, progesterone, and testosterone. Now, they are there to function in our system. And as long as they are kept in the balance in which they should be used, they are okay, because they are good chemicals given to us by our God so that we can be at our optimum. All right, but anytime things start happening that is causing the body not to be able to regulate them adequately, then we find ourselves in trouble. Okay, so let's look at the endocrine system first of all. The endocrine system secretes 50 different hormones throughout your body, and each plays a vital role in maintaining a kind of homeostasis, right, or stable body function. Okay, so all of these different hormones, they are doing something at different time, different places in your body, but they seek at all time to ensure that there's a balance, a kind of stability in our system. Due to the integral role of each hormone, it's no surprise that a slight imbalance of one hormone could be the catalyst of your nagging headache, unpredictable mood swings, increased sweating, or weight gain. All right, so you can be finding yourself with this chronic headache. Yesterday, the church that we went, there's a young lady who said that her head just consistently hurt her and she just cannot understand why. I asked her about, is there some form of stress? Are you drinking water? Are you taking any dairy? And she'll say, no to that. But do you know that if your hormones are not working adequately, you too can also be affected by these nagging headache, the mood swings, the sweating, or even weight gain. So what is cortisol? Remember I said that there are literal five hormones that will cause imbalance, and we are looking at this. Cortisol is a hormone produced in your adrenal gland that helps regulate your blood sugar, your metabolism, your inflammation, and your memory function. I need us to remember this, because this is something that's good. It's literally affecting us and we don't know. And mainly because we have some bad habits that we don't even think about. So we will be looking a little more on this. Thank God we have 2 sessions in which to take care of some of these issues. Most commonly referred to as the stress hormone. Now we're talking about our cortisol here. Cortisol is released during times of stress or crisis, and as a result, temporarily shuts down your digestion and your reproductive system. No, there might be some ladies here who want to conceive and they're finding that they're having problems doing so. Could it be that you are highly stressed? Could it be that you are not eating well? Could it be that your cortisol level is high? Because if you are having stressful situation, pregnancy is not it's not a good thing at that time. Your reproductive organs are troubled. And one of the simplest ways that I can tell you that can bring your cortisol level to be very high, increase the inflammation in your body, is lack of sleep. If you are given to going to bed very late in the night, then your cortisol level is going to be high, and your chance of having hormone balance would have been decreasing. Okay, if you are given into going to bed very late in the evening. Okay. What's the symptoms? What are the symptoms of high cortisol in the body? If your adrenal gland is producing too much cortisol, you may experience symptoms such as a flushed, round face, high blood pressure, increased thirst, irregular menstruation, mood swing, muscle weakness, reduced sex drive, and or weight gain. If too much cortisol is secreted over a prolonged period of time, it may increase your risk of developing Cushing's syndrome. Right, and you will notice this because of the eyes going out and the joints hurting and the neck start pushing out. You will notice these things happening to us. Okay, so if we consistently being stressed or we continue go to bed very late, then these are some of the things that can happen to us. And what we just look at is when the cortisol is too high in the body. Remember, we are looking at at 5 main hormones that tend to be imbalanced, that's causing us many of the symptoms that we are having. When too little cortisol is secreted, you may experience symptoms including dizziness. So you can look at what you are experiencing. Is it that I'm having the fatigue and the mood swing and the irregular period? All right, and the weight gain. When too little is secreted, you have dizziness, we have fatigue, mood swings, muscle weaknesses, and weight loss. Too little cortisol may be caused by Addison's disease, a condition where your adrenal gland doesn't secrete enough hormones. All right, so if enough hormones are not being produced, you are just as imbalanced as if too much is being produced. All right, so it can be one or the other. All right, so that is cortisol we look at, and we see the symptoms from there. Now let's look at estrogen. Anybody remember how many we said that we have that tend to be out of balance while we get the kind of sicknesses that we have as women? Anybody remember? Type it in the chat, put it in the chat. All right. Estrogen is one of the main sex hormones in women. We need our estrogen, ladies. We need our estrogen. As we get older, estrogen become less in our system. All right, but we can take care of ourselves to ensure that we are well fortified. While men have estrogen too, they secrete smaller amounts and do not experience the same effects from estrogen that women do. In women, estrogen is responsible for the physical changes during puberty, regulating your menstrual cycle and supporting your bones, your heart, your mood during pregnancy. In both men and women, estrogen helps to regulate cholesterol and bone health. So you see, we need our estrogen. It helps us to make us females. It is your estrogen that determine you as a female, you acting like a female. Okay, it might be in men, it is in men, but it has to a lesser degree, but it's more pronounced in us as females. Okay, now what happens when we have too high estrogen in our body? Too much estrogen in women may result in breast lumps. And ladies, please don't think that every time the breast has lump in it, it means that we have cancer. It's not true. The breast can have lumps because of hormone imbalances. Okay, so the first thing is that for you to go do a biopsy, because a biopsy sometimes can cause more hurt in your system than if you do a little more research and see what is happening inside of you. Okay. Okay, so too much estrogen in women may result in breast lumps, fatigue, feeling depressed or anxious, reduced sex drive, and or weight gain. All right, so if the estrogen is high, you might feel too depressed or anxious and reduced sex drive, and you might gain weight. Okay, with men, high estrogen can produce enlarged pectorals, infertility, and or reduced sex drive. High levels of estrogen could be the result of a temporary natural fluctuation of your hormones or a response to medication such as contraceptive or certain antibiotics. Now, this is one of the things that I feel for my young people. Sometimes they will be having irregular menstrual cycle, and the only solutions that's given to them, the only solution given to them is contraceptive. Now we're talking about young persons who might not be sexually active or at the age when they should be taking contraceptives in the system. And the side effects is so devastating to the body. Now, the solution is not to use this, but to find what is causing this to happen. We get to the cause. We reason from cause to effect. Okay, so that is what happened when it is too high. Now, let us look at what happened when it is too low. And we remember we are looking at estrogen. Low estrogen in women is typically a result of menopause. All right, so off the bat, we will get that. It's not the only reason, but typically this is the reason. Symptoms may include dry skin, an irregular menstrual cycle, hot flashes, mood swings, and or reduced sex drive. When men secrete too little estrogen, they may experience reduced sex drive and weight gain. All right. So in us as females, it tends to be that the symptoms, our skin become dry, and some ladies will suffer from vaginal dryness. The periods become irregular because remember the estrogen is responsible for our reproductive health. All right. It is important for us as female to, that's what make us female. So the hot flashes will come on. And I will look a little later, or if not this week, when we are looking at solution. If not this week, then next week. All right. So we can have the mood swing would be there, the hot flashes, the irregular menstrual cycle, dry skin, vaginal dryness can also occur. Okay. All right. What is insulin? So what are those that we looked at already? We look at cortisol, and we look at, what was the other one? Estrogen. And now we are going to be looking at insulin. So remember, these are 5 that we are looking at. The hormone insulin is produced by the pancreas and allows your muscles, fat, and liver to absorb glucose, also referred to as blood sugar, and break down fat and protein in order to regulate your metabolic process. Okay, so insulin is very crucial for our overall being. Very important for us to survive and be able to get glucose, to get the food into our cells. We need our insulin, this hormone, to be in our system. But it too can become irregular. It can be too high or it can be too low. All right. If it is too high, let's look at the symptoms. If the body secretes too much insulin, or if someone with diabetes injects more insulin than needed, they may develop hypoglycemia or abnormally low blood sugar level. All right, so it's hypoglycemia or low blood sugar level because the insulin is scraping out the blood sugar. All right. The symptoms of hypoglycemia may include anxiety, dizziness, heart palpitations, hunger, loss of facial color, sweating, and or tremors. Okay? To increase blood sugar levels, you can eat carbohydrate-rich foods or drink sugary beverage. So if it is that you are taking some insulin and you find you're having any of these kind of conditions, immediately you have to increase your sugar level. And by doing that, you can take some carbohydrate-rich food or drink something sugary. And the easiest thing we do is normally just get a little honey and put it in the person's mouth. All right, what happens when it is too low? When your pancreas is not producing enough insulin, it is typically a result of type 1 or type 2 diabetes, which leads to high blood sugar. Symptoms of high blood sugar may include dehydration, dizziness, fatigue, frequent urination, hunger, and or weight loss. Treatment for people with diabetes can include insulin injection or other medications. Your physician will determine the best treatment for your condition. All right. So remember that we said we are looking what happened when it is too high and what happened when it is too low. I will repeat that we are looking at the 5 main hormone imbalance that will affect our females. First, we look at cortisol. Next, we look at estrogen. Now we are looking at insulin. We look at what happened to the body when it's too high, and we look at ourselves when it is too low. What how the body respond to both of them. All right, the next one we are looking at is progesterone. The progesterone hormone is generally thought to be only present in women, but men have progesterone as well. For women, progesterone is crucial in menstruation and supporting the early stages of pregnancy. All right, so our progesterone is crucial for us as female. Very crucial. It's what makes us blossom into beautiful women. For men, progesterone helps support fertility and balances the effect of estrogen on the body. All right. So ladies, we need our progesterone. It is what makes us shapy and beautiful and look like, you know, we are ready for the road. We are females, we are ladies. So there are two hormones, I should say, basically, that will determine us being who we are as ladies. And that's going to be your estrogen and your progesterone. Okay. And most of the things that happen to us, these two tend to be affected. Okay, so let us look what happened when it is too high. What are the symptoms we will go through? In men, high progesterone levels will increase estrogen levels, which can result in symptoms such as depression, fatigue, and the development of heart conditions. For our women, when our progesterone is high, the symptoms usually include anxiety, bloating, depression, reduced sex drive, and our weight fluctuation. All right. So this is what will happen to us when our progesterone is too high. What happens now when it is too low? Low progesterone levels in men may produce symptoms including bone loss, erectile dysfunction, fatigue, hair loss, and or weight gain. When women have low levels of progesterone, they may experience abnormal uterine bleeding. Now, this is something that we have to deal with a lot of times, because the ladies will be having this in-between bleeding, okay? And they cannot understand what is going on. The balance of the estrogen and the progesterone is such that it can cause this to happen. Uterine bleeding, an irregular menstrual cycle, frequent miscarriages. I know one lady, she had 5 miscarriages, okay? And where we need to look, be looking at the progesterone that in the system if it is too late. Pain during pregnancy, reduced sex drive, and our weight gain. All right, so when it's high, you might have weight loss. When it's too low, you might have weight gain. Okay. Now let's look at our testosterone. I bet you didn't know this was something that we have. We normally associate testosterone with men because it's a main sex hormone for men. While women also have testosterone, they have smaller amount and do not experience the same effects from testosterone that men do. For men, testosterone supports the physical changes during puberty, such as deepening of the voice and growth of the genitals, hair, and muscles. In women, testosterone supports bone health and reproductive tissues. All right. So you notice that we really do need it because it is good for our reproductive health. Okay. But we don't need it as much. Now, what is the opposite? Should I call it opposite of our of the testosterone for women? What it would have been? All right. For us as female, two going to work together, and that's going to be our estrogen and our progesterone. All right. What are the symptoms of high testosterone? It is easier to determine when a child has too much testosterone because it typically results in precocious puberty or an early development of sexual characters. When an adult develops high testosterone levels, it may increase the chance of infertility at a younger age. All right. In essence, what it is saying, when a girl have testosterone at a young age, then you start find that they tend to be more tomboyish, you know, more of the men tendency that they will pick up. Okay. But as we develop more into adults, and you find that infertility might set in, because when the testosterone level is high, more than likely the estrogen or the progesterone level might be low. All right. What if the testosterone is too low? Signs of low testosterone level in men may include enlarged pectorals, low sperm counts, mood swing, poor erection, and our reduced sex drive. Women may experience fatigue, muscle weakness, reduced sex drive, and our weight gain. All right. So ladies, we do not experience fatigue, muscle weakness, or we can have a low sex drive. And that is talking about when our testosterone is low. So if it's not low, then we might be okay. All right. Body change. As we age and our bodies change, our hormones fluctuate to adjust to these changes. All right. So as we get older, the bodies are changing. There is nothing we can do about it. Our bodies are just going to change. And sometimes we hear persons talk and they will say, age is just a number. It's not true. Not to your body. Every year you get a little older, and the body knows. You can look like 16, feel like 16. Your body does know that you are 40. And as long as they are 40, the body is going to be changing to match 40. All right. Except that you can slow down the body is aging. All right. Our hormones fluctuate to adjust to these changes. It is natural to feel some symptoms related to fluctuation in hormones. However, If your symptoms persist or worsen, your primary care physician can help you manage your condition. All right. So as we get older, the body is getting older. So things are slowing down because we are getting nearer to the grave. Oh, yes, we are. All right. We are getting nearer to the grave. So therefore, the body start going through its changes. But guess what? The Lord has promised us that we can prosper and be in health. It just means that we have to make the necessary adjustment. We have to know that life does not continue. You cannot at 40, 50, you are eating like when you were 20 and 15 and 30. No, the body is changing. Your metabolism is changing. Your hormones are changing, and therefore you have to accommodate these. No, I'm not saying to give in to them and just lay down and die. No, you have to understand that things are happening, so you need to do something about it. For example, let me give you a practical example. As we get older, our estrogen levels start going down. So by the time you reach 40, 45, somewhere there, your estrogen is start decreasing, right? It's being depleted. It means, therefore, you have to look now, what are some of the estrogen-rich food that I can include in my diet? Because my body is not producing as much as it would have when I was younger. So you look for something like your flaxseed, your grounded flaxseed. You'd want to take in like two tablespoonfuls daily. You can also do the same with your chia seed. All right, you will find that your omega-3 fatty acid will be depleting. So this will affect your mood. So you're going to look at things like your walnut. All right, you're going to look at your olive oils. You're going to be looking at your chia. You're going to be looking at these things to ensure that what your body is lacking, you can make up for it in your diet. All right, so that's a practical example. All right. Hormone imbalance may be to blame for a range of unwanted symptoms, from fatigue or weight gain to itchy skin or low mood. Hormones are chemicals produced by glands in the endocrine system. Remember, we looked at the endocrine before, and we say that it produces how many? Let some bright student tell me how many hormones did I say that your endocrine system is responsible for producing? All right, so the glands in the endocrine system, and then they will be released in the bloodstream. An imbalance occurs when there is too much or too little of a hormone. All right, so I'm going to my chat and I'm going to look and see if I have a bright student. Janet, bright student, Pat Kareem, Janet, Rosin, Maxine Powell, Rosalind iPhone. You got an A. You all got an A. You got an A, yes. Our body produces 50 endocrine system produce over 50. All right, over 50 different kinds of hormones. The ones that we are looking at presently, we are looking at those five that okay, hold on a minute, please. Let me mute this person. Okay. All right. So we are looking at those now, that the five that we are looking at are those that will affect or give us hormone imbalance as females. Okay. So this is how the five comes in. All right. Important. Your hormones are important for regulating many different processes in your body, including your appetite, your metabolism, your sleep cycles, your reproductive cycles, and your sexual function, your body temperature, and your mood. In other words, we are one bunch of walking hormones, aren't we? Because everything, no, look at all of this that it's talking about. It is your appetite, so it's controlling your eating. It's looking at your metabolism, or your body use up the calories that you might consume. You're looking at how you sleep. You're looking at how you reproduce. You're looking at how you relate as a human being to the opposite sex. It's looking at even your body temperature. And of course, it's going to affect who you are as a person, your mood. All right. So hormones are so crucial that we have to be more aware of their importance in our system. No surprise then that even the slightest imbalance may have a noticeable effect on your overall health and on your well-being. Okay, so levels of hormones naturally fluctuate at various stages, life stages, most noticeable. And I'm going over this, and I need you to remember the 4 stages that we look at during puberty, and in women during the menstrual cycles, your pregnancy, and your menopause. Remember those four cycles. They can also be affected by your lifestyle and certain medical conditions. What is important is to notice any symptoms and get them checked out by a qualified health professional so that you receive appropriate treatment, whether that involves using medication or complementary therapies or making lifestyle changes to restore the balance and your good health. Now, I want you to note something that I just mentioned. I want you to look at this. I said, whatever it is, so that changes can be made to restore the balance and to your good health. In other words, it's not a death sentence. That don't accept it, that this is how you are. I have seen person going through menopause, and I'm going to be looking at menopause in our next presentation. But I have seen persons going through this and they just accept it. They're told that, you know, that's menopause, and just shrug the shoulder like this is, you have to live like this because you're going through menopause. No, you don't have to. Menopause is not natural and it's not normal. It is imbalanced. So balance the body and allow the body to take care of you. You do not need to live that way and keep fanning and sweating and be miserable, and you can't enjoy anything and you can't go anywhere and the mood swing is there. Oh, it is such a menopausal symptoms is such a curse. All right. But I am saying to us this evening is that we can be restored. You can be restored to health. The important thing is for us to identify what is happening and for us to do something about it. All right. Let's go to our next slide. All right, so we are going to be looking at them now. Let's look at this. Mood swing. The female sex hormone estrogen has an effect on neurotransmitters in the brain, including our serotonin. This is a chemical that boosts our mood. Fluctuation in estrogen can cause premenstrual syndrome. The PMS that most young persons go through can also cause depressed mood during the perimenopausal time. That is the phase before period stop completely, and it also affects us during menopause. Now, I want you to look at something. This word, serotonin. Now, I want you to type in the chat, what is our best source of serotonin? What is our best source of serotonin? Anybody want to venture into that? Where do we get serotonin? What can we do to ensure that we don't end up with the mood swing? Because serotonin is the one that boosts our mood. All right, so let me go to my chat, and I want to hear from a bright student. Oh, let me see. All right, okay. All right, you're lighting up, you're lighting up. Brown D, you are correct. Nardia, you are correct. Cassandra, yes. Janet, that is correct. Maxine, that's correct. Yes. Maureen, that's correct. That's correct. Ace family, you are correct. Rosalind, you are correct. And Pat Karim, you are correct. All right. So, Canelia, you are right. So sunlight, vitamin D, really. The sunlight will produce the precursor, give us a precursor of vitamin D. So serotonin, we need to be getting sunlight. Ladies, make sure that you expose yourself to the sun. More than our men, it is the ladies who tend to run away from sunlight because we don't want our complexion to be damaged. We don't want our makeup to run. We don't want all kind of things. All right. There are a lot of things that we don't want to happen to us. So we run from the sun, not understanding that it is more likely we are taking care of the external while internally we are being affected. Okay? Get your sunlight. It is your serotonin is your feel good medication. It is a natural drug given to us by God so that we can be made well. No, the question will be asked from those maybe in the US and Canada or UK, those first world countries where they tend to have a lot of snow or it's very cold and there's not a lot of sun. What do? Get a very good supply of vitamin D3 and take it, especially during the seasonal time. Use that so that you can be getting the vitamin D drops that you would have needed. Thank you, Janet. All right. So you do your vitamin D drops, and this will help you to get your serotonin. You will take it in the morning, all right, so that you will end up with your melatonin, your restful period in the night. All right, heavy or painful periods, this is another one. If accompanied by other symptoms such as abdominal pain, a frequent need to urinate, lower back pain, constipation, and painful intercourse, then you may have fibroids. Should I repeat? Let's look at fibroids. When you're having heavy or painful periods, and sometimes it is accompanied by such thing as your abdominal pain, frequent need to urinate, lower back pain, constipation, or painful intercourse, then you may have fibroids. Fibroids are non-cancerous growths that develop in and around the womb. The exact cause is unknown, although they are thought to be stimulated by estrogen, while having a family history may also increase your risk. So there has not been a one set thing that has been accepted that this is what caused fibroids, but it has been shown that when during the years when estrogen tend to be high, then the fibroid is more likely to occur, because it has been seen that when you pass through when you're going through menopause or perimenopause, that's a period before, when estrogen gets low, then the fibroids tend to shrink. Okay, so just thought I would mention that to us. Low libido. Low libido is particularly common in women going through the perimenopausal or menopausal phase due to falling levels of estrogen and testosterone. All right. Other menopausal symptoms such as night sweat, fatigue, low mood, and anxiety can also have an impact on your sex life. All right. And another thing that can happen during perimenopausal or menopausal phase, ladies can also be going through, will also maybe have vaginal dryness. Okay, no, these are things that can be taken care of. I can say that because I specialize in women's health. So I know that it's not a death sentence. You don't have to say, this is what happened to me, and you think that your life, as you know, it is over, and then we get depressed from it. No, we know. But as a matter of fact, let me warn our ladies, and I want to say thanks to Sister Donna for initiating this conversation. Please do not wait until the things are happening to you before you start doing something about it. If you are 20 something or 30 something and 40 something, you are not yet going through menopause. You are going to go through there. Things are going to affect you. And I would say to you, start taking care of the body now and do not wait. We are told in the book, Ministry of Healing, it said too little attention is normally given to the preservation of health. It is better to know how to retain health or maintain health than to know when you're sick how to get rid of it, because sometimes it's so much harder. But take care of yourself now so that as you get older, some of these symptoms do not have to happen to you. All right, but if you don't, there's a sure sign that it is going to happen. All right. So, but it doesn't have to. If you're going through it now, do something about it. Things can be done. All right, insomnia. Insomnia and poor quality of sleep. Insomnia is when our inability to fall asleep. During the perimenopausal and menopausal period, the ovaries gradually produce less estrogen and progesterone. And these are the ones which promote sleep. So if these are going low, then sleep is going to, evade us. Falling estrogen levels may also contribute to night sweats, which disrupt your sleep, contributing to fatigue and lack of energy. Dare I say then, we need to do something about it. It does not have to happen. Estrogen is going low, progesterone is going low, but guess what? Vitamin D is there from the sunlight. Take the sun in the day so that you can have good sleep in the night, because as you take the sun in the day, then your serotonin is converted to melatonin in the night. So you can get to go to bed in the night and get good rest. Or you take good quality vitamin D, you take it early enough in the morning so that by nightfall, you will also have the melatonin and you can get some good rest. Okay, another thing, make sure you're exercising. All right, make sure you're exercising, as this will help to give you good sleep. Okay, let me go to my next one. Weight gain. Unexplained weight gain. A number of hormone-related conditions can cause weight gain, including an underactive thyroid. When your thyroid gland does not produce enough thyroid hormones, which regulates metabolism, polycystic ovarian syndrome, which is a hormone-related problem causing small cysts on the ovaries, and the menopause, which result in hormonal changes that can make you more likely to gain weight around your abdomen. Okay, so when the thyroid is underactive, okay, it is going to affect your hormones that's responsible for ensuring that your metabolism is regulated. Okay, so it's more likely that you're going to be having your PCOS, which affect a lot of young people, and menopause is also be affected. Okay, so very important for us to take care of our thyroid gland. Okay. Skin issues. No, chronic adult acne can be a sign of low levels of estrogen and progesterone and high level of androgen hormones, and can also indicate polycystic ovarian syndrome. So if your skin starts breaking out and you have acne as an adult, when this never used to happen to you in your younger days. Similarly, hormone imbalances during pregnancy or the menopause can cause itchy skin, while dry skin is a symptom of the menopause or thyroid problem. All right, so hormone imbalance, you can end up with itchy skin or the acne, while the menopause and can show that you're having thyroid problem. All right, let's look at our fertility issues. Right, let's look at fertility issues also. Hold on, please. Okay. All right. Hormone imbalance is one of the leading causes of female infertility. And with changing hormone levels, a woman's fertility naturally drops after the age of 35. All right. So it will drop. So most time we encourage persons, in the younger years, as soon as you pass 35, then they start categorize you into the high risk group. High levels of follic stimulating hormones can reduce a woman's chance of getting pregnant, while low levels of luteinizing hormones, which stimulates the ovaries to release an egg and start producing progesterone, can also cause fertility problem. Now, let me go back over that because there might be a female here who might be wondering what is going on with me. Why is it I'm trying to get a child and it's not happening? So let me go back over this a little slower so that we can get it. I want you to be educated on the matter. Even if it's not for you, maybe you can help someone else. So let's look at this again. Hormone imbalance is one of the leading causes of female infertility. And with changing hormone levels, a woman's fertility naturally drops after the age of 35. So we are clear on that part. After 35, it starts going down. High levels of the follicle stimulating hormones, all right, that can reduce a woman's chance of getting pregnant. All right. So when the follicle stimulating level, when it is too high, it's going to prevent sperm from holding into the woman's womb. Right. And when there's low level of the luteinizing hormone, so I want you to see these two. Look at them, FSH and LH. And this is what stimulates the ovaries to release an egg. So it is your luteinizing hormone which will stimulate the ovaries to release an egg and start producing progesterone, can also cause fertility problems. All right, I will look at that in our next presentation next week. Early menopause and other hormone-related conditions such as PCOS will affect your fertility. So once you're finding out, you have been married 2, 3, 4, 5, 6, 7, 8, 9, 10 years, and nothing is going on. The man has checked out himself, and his sperm count is okay. So that's not where the problem is. And you're trying to find out what is going on. Chances are this can be the hormone imbalance area that need to be looked into. All right, headaches. Many women suffer headaches due to hormonal changes during the menstrual cycle, during pregnancy, or menopause. Sometimes there might be weak bones, falling levels of estrogen during the perimenopausal and the menopausal period can cause bone loss. All right. No, I need us to remember, look at especially the North American countries, you'll find that older persons tend to break their bones easily. All right, because by then the estrogen level is low. What's that? Oh, the estrogen level is low, and therefore the bone become brittle. Okay. And they can, because they start breaking these bones. Okay. Vaginal dryness. Vaginal dryness is most often caused by a fall in estrogen level, especially during the perimenopausal and menopausal time. Taking the contraceptive pill or antidepressant can also change hormone levels, resulting in this problem. All right, so if you take the contraceptive pills, this can happen. If you're on antidepressant, this can also happen to you. So what you want to do is ensure that you recognize there's an imbalance going on and do something about it. Wild yam cream is excellent during this time. All right, we talk about the flaxseed, very good for taking at this time also. Okay, because this will help. Consume adequate amount of protein. Now, these are some of the things that we want to look at that can help you. Consuming adequate protein triggers the production of hormones that suppress appetite and help you feel full. Aim for a minimum of 20 to 30 grams of protein at each meal. All right. Engage in regular exercise. All right. I think I'm going to leave some of the solutions for that would have looked at this week until next week. I want us to just get a basic understanding of what is happening in our bodies. So I'm going to look at 3 things that we need to be doing right about now, as this is very helpful for us. So one of the things that we look at, let me go back, is that the protein must be adequate. Adequate what you're having as protein, 20 to 30 grams of your protein. Okay, and then engage in regular exercise. Now, this is crucial for us as we get older also. Physical activity can strongly influence your hormonal health. Never overlook that. And the best form of exercise that you can do would have been your walking. You don't need to go out to do it. You can stand right on the spot. You can move up and down in your living room, in your bedroom. You can work up a nice sweat, same place. A major benefit of exercise is its ability to reduce insulin levels and increase your insulin sensitivity. Have to be on a walking program. We have to be on an exercise program if we are serious about hormone imbalance. Performing strength training, aerobics, walking, or other forms of physical activity can modify hormone levels in a way that reduces the risk of disease and protects muscle mass during the aging process. All right? So this is very important for us to get physical, as this will help us in the imbalance that's taking place. Remember, we look at insulin, why it's so important where insulin is concerned, that the level be controlled. And also we can increase our sensitivity. All right, so we know how to the body can gauge itself, let you feel fuller, quicker, stay full longer, and ensure that it spill excess. Okay. All right. The next thing that we will look at, last but not least, I will give you an opportunity in case you have your question you can ask before we close out for this evening. And next week, I want to pick up on our treatment. I want us to look a little more at menopause, and I want us to look also at how do we control this hormone imbalance. All right. So I'm going to be looking a little at this, but I need you to give you an opportunity to ask your question. Diets high in sugar and refined carbs have been shown to drive insulin resistance. Avoiding these foods and reducing overall carb intake may decrease insulin levels and increase insulin sensitivity. All right. So diet, your diet, when you have the sugary things, the refined carbohydrate, you need to be eating complex carbs in your diet. So we're talking about your brown rice. We talk about like your ground provision. We look at your whole grain oats. All grains are way better than all the refined that you can put together. We want to ensure that sugar and any form of sugary things are not in your diet. All right, especially as you are experiencing this. Even if a young person come to me at 20, maybe 20 something, we know. All right. So even for young persons, we'll have to change their diet. I remember one young girl, she came to me and she had PCOS. She was, I think she was about 22, 23. And the doctor, she had endometriosis, she had PCOS, she had so many cysts on her womb, all kind of things that were going on. And She was so badly affected that the doctors were telling her to just take out her womb. There was no way she could have a child that way. And she had just married a year. She came to see us, and I give God thanks that today she has a nice, beautiful, bouncy little baby boy. All right. So there's always help. There are things that can be done. It's just that you have to be vigilant about yourself and give your body a fighting chance to live. Give your body a fighting chance. Okay. Let me stop here and find out if there are any